Every day, 2 women lose their life to cervical cancer, but it's also one of the most preventable cancers, and cervical screening can help stop it before it starts. Earlier, I had some life-saving conversations with some incredible women around why it's so important to attend your screening when invited.
Hello, Dr. Zoe, how are you?
I'm very well, thank you. So I believe you have a question for me.
What I've been hearing is that the test itself has potentially changed now, and it's now testing for the HPV virus.
Yeah, you're right. HPV is human papilloma virus, and this is a really common virus, and usually it just goes away on its own. Your cervical screening sample is first tested for HPV, and that's a more accurate and more sensitive way than the previous way, and it lets us know who is at higher risk of having abnormal cervical cells that can potentially progress to cancer further down the line. So the important thing to remember is that having HPV does not mean that you have cervical cancer.
And how long does it take a cervical screening and what does it entail?
The actual test only takes 2 to 3 minutes. When you go into the appointment, the nurse or the doctor that is seeing you should explain what's going to happen. And then they're going to ask you to undress from the bottom down and lie on a couch. And that's when they give you a paper sheet as well that you can pop over yourself. They'll use a speculum and a soft brush to just brush a few cells off the cervix, and that's what's sent off as the sample. We have different techniques to make you feel more comfortable. So whether it's breathing exercises to really help you relax, if you'd rather listen to music,
Heavy metal,
whatever works. Remember, cervical screening is available to women and people with a cervix aged between 25 and 64 years. If everyone attended screening regularly, 83% of cervical cancers could be prevented.
If you have had your HPV vaccine, do you still need to attend your screening?
Because it doesn't protect against all of the types of HPV that can cause cervical cancer, it's really important that once women reach the age of 25, they attend their cervical screening appointments as well. So you've both had cervical screenings in the past, Louise probably many, and Sharon, you're 26, so you have also had one. What have your experiences been?
You're always a bit scared because you hear misconceptions about things from other people, and you're always worried, I think, one, it's embarrassment and whether it's going to hurt or not.
I always say, best thing you can do if you're feeling embarrassed, if you're feeling afraid, always just share that with the person, whether it's a nurse or a doctor. The thing to remember is you were in control.
I think it's really helpful. Next time it arrives, I'll think, it's going to be all right. And I always go anyway, but, it's with a sense of trepidation.
And tell your nurse or doctor, that you've had these anxieties. Ask them to have a look at the brush.
I'm going to look at the brush. I think I'm going to look at the brush. Do you want to see the brush?
Yeah, I definitely want to see the brush.
All of that is fine. We can show you the brush. And if it makes it more comfortable for you, at the end of the day, everybody's happy. Remember, cervical screening saves lives, so don't ignore your screening invite. And if you missed your last one, book an appointment with your GP practice or your local sexual health clinic now. For further information, visit nhs.uk/cervical screening.